Yeah. Do you believe that some of our politicians are suffering from this mental illness that I want to talk about now? The mental illness is called kleptomania. Kleptomania is a rare but serious mental health disorder characterized by a recurrent, irresistible urge to steal items that are not needed for personal use or monetary value. People with kleptomania often feel tension before stealing and a sense of relief or gratification afterward. That is why you see some of our politicians have this disease. They have this disorder. However, the heart is typically followed by guilt, maybe when EFCC have arrested them, shame, or remorse. There are key features of kleptomania, a very serious mental health disorder. One, repeated failure to resist impulse to steal. If you tell them not to steal, they will still steal. Items stolen are not needed for personal use or financial gain. Most of them, they amass wealth that they will not use. Their grandchildren will not use. They just keep those things inside their house, in their house. 3, increasing tension before the theft. 4, pleasure or relief during or shortly after the theft. Some of them, we know. We have them as our family members. They are politicians in this country. The behavior is not better explained by conduct disorder, manic episode, or antisocial personality disorder. These are just key features of kleptomania. What are the causes and risk factors? The exact cause is unknown, idiopathic, but several factors may contribute. 1, biological factors. There's something I want you guys to know is when you have this disease, people might think that it is your village people that is doing you. When you have the disorder, that it is your village people. Maybe this person is caused, or this person is being affected by, is victimized by the village, or probably this person is under village curse. Like I said, village people curse. But one of the causes and risk factor is biological factors. Abnormality in brain chemicals such as serotonin and dopamine. These are neurotransmitters. So this neurotransmitter, when there's abnormality in them, you're likely to steal. You have the irresistible urge to steal. 2, genetic predisposition. Sometimes family history of mental illness or impulse control disorders can actually make you to be stealing irrespectively. You will steal because it is already in your family history. So stealing or being a thief is hereditary. It is hereditary. For you to know today, it is hereditary. So 3, we have co-occurring disorders. This of co-occurring disorder is one of it is depression, anxiety, substance use disorders, and eating disorder may occur alongside kleptomania. That is when you see them, they will be eating anyhow. They are thieves. They have kleptomania. How do we diagnose them? Because it's a very serious mental disorder. So because of that, it's been diagnosed based on psychological and psychiatric evaluation. And sometimes we use the criteria outlined in the DSM-5, diagnostics and statistical manner of mental disorder, to diagnose them. For you to actually know that this person is suffering from kleptomania, you will tell them you stole something and you felt remorse last week. Why did you steal again? They will steal again. They will still steal again. They will still, no matter the shame and guilt, they will still steal again, because they have a disease. They have a disorder. They have inherited disorder. They have the disease is hereditary in their family. What are the basic treatment of kleptomania? Actually, there's no specific cure for kleptomania. That's why you see them, they conduct the heart again. But treatment can help manage the conditions, I mean the symptoms, and reduce the impulse to steal. And one of the treatment I can actually use to manage the symptoms and reduce the impulse to steal is psychotherapy. Like one of the psychotherapy is the cognitive behavioral therapy, which is the most effective approach. It helps the individual affected and change harmful thought patterns and behavior, just like nymphomania. Techniques like covert sensitization, imagining negative consequences of stealing, and systematic desensitization, that is gradual exposure to situations that trigger the urge, are commonly used. Sometimes medications are being provided for people that steal. It's not just that it cures it, but it reduces the symptoms and the urge to steal more. We need to start giving our politicians, some of these politicians, selective serotonin reuptake inhibitors, because the serotonin and dopamine is affected. The chemical messenger, the neurotransmitter, are already affected. So you need to give them XXRI, selective serotonin reuptake inhibitors. Then two, mood stabilizer or opioid antagonist. We need to start giving them so that this can reduce the urge to steal. Medication